Hello and welcome to another Wellness Way USA podcast. I'm your host, Jeb Odom, and here we have Dr. Robert Corvino of Array Strength. Today we're going to talk about IBS and IBD. Who knows what IBS and IBD are? Well, I didn't know much about it. I knew IBS was kind of like a discomfort that a lot of people had. I mainly just thought it was a sensitivity issue. So IBS, give me your easiest explanation of what IBS is.
Yeah, absolutely. So, IBS is known as irritable bowel syndrome. And essentially, what it is it's a combination of symptoms that are presented in a patient that can be things like nausea, discomfort, fatigue, even some headaches, stuff like that. And then the main things like constipation, diarrhea, bloating.
So something that you're going to notice probably over a period of time that's not normal, or it may interfere with your life to a certain extent.
Absolutely.
What's the main group that you see that has this condition?
So the main population is going to be females between the age of about 20 and 45.
Okay, so a younger age range.
It is a younger age range, and it is predominantly women.
Wow. And I know we had read in my research, we'd read that many people have this problem. They find this problem later or have it diagnosed later in life. Why do you think that is?
Typically, the reason it's diagnosed later in life is because, most people that I'm probably talking to right now, even you, we've all had stomach issues. Everyone has presented with some sort of stomach discomfort over their lifetime. A lot of people tend to think it's normal. So sometimes it's diagnosed late simply because it takes getting to a certain point where you actually go to the doctor to do something.
You get fed up.
Yeah.
Yeah. Um, and I was when we were researching, we found that somehow they have some kind of psychological issues that are related to this. Where does that connection come from?
Yeah. So there's something called the gut-brain axis, and essentially what that is that's the neurological connection between your brain and your GI tract. And stress actually plays a huge role in GI symptoms. So typically, especially with a lot of the patients I work with, stress is going to be a big factor that I address. And the reason for that is because mental health plays a huge role in all of those gut symptoms.
So if the symptom is not something that you could actually, look at with a test, how do you find that IBS is actually the disorder that they might have? How do you narrow that down?
Can you ask that one more time?
Um, how do you since diagnosing or finding the cause of IBS is sometimes difficult, what is your method for finding IBS or what's called IBD,
Mm-hmm.
which is an inflammatory bowel disease?
Yeah.
So what is the overall methodology you use to find out the source?
Yeah, so typically there's going to be some testing that is really important when it comes to IBS. IBS is actually a condition known as a diagnosis of exclusion. So when we look at IBS and we're trying to make this diagnosis, realistically, the tests that are going to be prescribed are going to be looking for gross abnormality, right? They're looking for this major tissue damage. They're looking for gastrointestinal bleeding, ulcers, polyps, even cancerous masses. When they don't find any of that, really what they're saying is that, because the symptoms are still present, there is still some sort of GI condition that's occurring, and that is going to be what's labeled as IBS.
So they go to the highest level, the most risk,
Mm-hmm.
and they try and make sure that those aren't there. And if they do find one, then they'll complete that cycle of treatment. And then if there isn't anything they find with those higher risk diseases, they come back down to the IBS treatment because it's not a more serious as IBD would be.
Absolutely. We're always looking for, that most complex, dangerous case first. We want to rule out anything fatal, any red flag, right? And that's really
life-threatening.
Exactly. That's the case with all healthcare. We're looking for red flags first.
Mm-hmm.
Once you rule those out, we can actually begin working with the condition. But, because those are the most life-threatening, you want to be able to rule those out before you do
Yeah,
anything else.
yeah, that seems to be the best way to go about it. So, what can patients help themselves to try and figure out if their discomfort or their improper bowel movements are part of something they're eating or maybe something else with the environment? Can they try to kind of fix this on their own or reveal it on their own or maybe help you reveal it?
Yeah, absolutely. So, when it comes to patients doing it on their own, it's all going to depend on the patient presentation. It's going to depend on the severity of the condition. But with most minor IBS type cases, you can typically see some really good results at decreasing your symptoms very easily. And the biggest component is really going to be your diet. So, what they've found in a lot of research is that there's specific triggers that cause a lot of these GI type symptoms. When you remove those triggers, so whether that be dairy, a lot of people have that lactose intolerance, they have that sensitivity towards lactose, gluten, whether they have, maybe they have um, a challenge digesting FODMAP type food. So FODMAPs are going to be fermentable carbohydrates. Removing those things from their diet typically has the ability to remove a lot of those lower grade symptoms. Now, if the condition's more severe, then that's going to be something that it might be better to seek out a professional, because after removing, those trigger foods, there still might be some symptoms that are present.
So it might be one of those, you see your regular doctor, and then he says, this, give it some time and let's see how this progresses. Maybe that's a time when you might try some exclusion dieting or things like that. Um, I noticed they had a test here that was a called a breath test for bacterial overgrowth. Do you know anything about that?
Yeah, so what they're looking for is they're looking for any type of bacterial overgrowth. Bacterial overgrowth typically happens when your immune system is decreased in any way. So your GI tract actually has about 80% of your innate immune system. The reason being is because that is the first place where your body actually encounters the external world, right? So when you eat food, that's literally coming from the external world, and everything that's absorbed into your intestines and then into your bloodstream has to that first pass through there. So your immune system is super condensed in your GI tract. What happens is when your immune system is decreased, your bacteria or that negative bacteria will actually begin to overgrow, because now your blood cells aren't eliminating that excess bacteria. So they can actually measure that in your breath.
Wow, like a breathalyzer for disease.
Mm-hmm.
Really strange. I've never heard of that before we started researching. What about supplements? A lot of people say, "Well, I've got upset stomach or some digestion problems. Let me take some fiber or let me eat some yogurt." Is that something you would say that that's a good course of action immediately, or is it something that maybe something you should do later in the process?
The biggest thing when it comes to these types of conditions is the complexity. So when it comes to the patient presentation, it's all going to vary. And that's why it's hard to give a general recommendation for someone, because, I tell people all the time, if I have 10 IBS patients in front of me, they're all going to get a completely different program. And that's because the complexity of the disease is extremely high. So a recommendation I would definitely give would be taking some sort of high quality probiotic, because what that's going to do is that's going to start to replenish your healthy gut flora. Now, there are certain cases where taking a probiotic may actually make the symptoms worse. If that is the case, then that's something that you should be avoiding. The reason that actually happens is because most of the time when those symptoms gets worse, it's due to what's called SIBO, which is small intestinal bacterial overgrowth.
Do antibiotics play a role in affecting your gut flora? So when you take, let's say you have a cold and you take antibiotics, you seem to notice, your stomach's a little weird after that, your digestion's a little weird, your bowel movements are a little different. Is there something to that?
Yeah, absolutely. So antibiotics, they don't just kill healthy bacteria; they actually kill unhealthy bacteria as well. So there's a recommended time frame when you take an antibiotic, and what it does is it's not only wiping out that pathologic bacteria, but it's all of that healthy bacteria, that good flora that supports your immune system, helps you produce these important nutrients, these metabolites that help increase the structure of your gut lining. It actually wipes out that bacteria as well.
So if you're in that situation and you've taken some antibiotics and you've been successful with that treatment, your doctor clears you, what is the first food that you would eat maybe to help reestablish that?
Yeah, I always recommend eating foods that are really high prebiotic foods. So prebiotic foods are foods that are high in what's called prebiotic fiber. Prebiotic fiber actually feeds your healthy gut flora. So you're going to have things like sugar and refined grains, which is going to feed unhealthy bacteria. Prebiotic fiber is going to feed your good bacteria. So having a diet that's really high in prebiotic fiber, especially after a bout of antibiotics, is going to really help to increase that flora. And then on top of that, increasing probiotic foods. So things like raw milk, which not a lot of people have had, but some of these older type foods from older generations, so things like kefir, things like raw milk, sauerkraut, some of these fermented foods, sourdough bread, they're really going to play a role in replenishing that gut flora. So, one of the recommendations I make is try to eat at least one probiotic food a day, whether that means drinking a cup of kombucha, having a piece of sourdough bread, and then increasing that prebiotic fiber with things like green leafy vegetables, broccoli, cruciferous vegetables.
So don't go for that fiber supplement. Try and get the food.
I always prefer that people try to get as much from their whole foods as possible. There is a point where supplements are going to be really important, but just right off the bat, I like to encourage people to eat as much whole foods as possible.
And the nutrients in the soil. We've read about the way farming is now, and are you going to get adequate nutrients, or do you suggest maybe a general addition to a diet, any person's diet?
That is a really big kind of argument right now that's happening. Is are we getting enough nutrients from our food? Are we not getting enough nutrients? What I would recommend is most people don't have a solid diet. So, if you don't have a solid diet, it's going to be really crucial to have a multivitamin. But there was actually a really, really well renowned nutritionist who did a study, and what he found was that even after creating an optimal, perfect diet, he was still limited in multiple major vitamins and minerals. So even if you have a great diet, even if you're someone who really focuses on what they're eating every day, I believe that it is very crucial to optimal health to be supplementing with a really high quality whole food multivitamin.
Um, People with this disorder, IBS or even IBD, but more on the IBS side, why do you think it's so difficult for them to gain an accurate diagnosis sometimes? You read about these case studies. I read one from Prevention. A woman, 33, suffered from IBS from childhood, finally received her diagnosis at 33 years old, ended up finding out it was pelvic floor dysfunction. So it seems like there's quite a few people that can't get this remedied,
Mm-hmm.
And I'm sure she's tried throughout the years, but is that something you see as well?
Yeah, so you're right to say that they have difficult getting it remedied. I wouldn't say that it's difficult to make the diagnosis. I would say that it's difficult to find the treatment, right? So one of the main reasons that I really got into this field is because gastrointestinal conditions for a very long time weren't seeing very good, successful, essentially, reversing of the conditions. So giving the actual functional diagnosis isn't really the issue. The issue is finding a specific formula to radically decrease the symptoms and drastically improve the quality of life.
Kind of the reason you're here, really.
Mm-hmm.
You're here because you're doing it a different way. You're focused more on finding that root cause and then addressing that.
Mm-hmm.
Some people may still be confused about IBD and IBS. If you don't mind, I'm going to read just what I found from the Colitis Foundation. It's Crohn's Colitis Foundation.org. IBD is classified as a disease. It can cause destructive inflammation and permanent harm to intestines. The disease can be seen during diagnostic imaging, and there is an increased risk for colon cancer. IBS, on the other hand, classified as a syndrome, defined as a group of symptoms, does not cause inflammation, rarely requires hospitalization or surgery, no sign of disease or abnormality during the exam of the colon, no increased risk for colon cancer or IBD. Is there anything you want to say about that?
No, that those are pretty accurate. So yeah, IBD, your inflammatory bowel disease, is going to be any type of gross finding, right? You're going to be finding some sort of damaged tissue. You're going to be finding that high level of inflammation, and that's theoretically going to be driving that disease. IBS, on the other hand, you're not going to have any of that gross finding, and what you're going to find is you're going to find that it's a diagnosis made off of the uh, the combination of symptoms that are present.
And it seems like maybe these, and it's just my take on researching and listening to all this. It seems like IBS might have more difficulty being treated because it's a little less intense, a little less severe. There's nothing to point to sometimes, so they'll study it, and your doctor's time is important, and there's other patients, and if you have something that's not as serious and he can't trace it down, it might be more difficult to treat a doctor to treat you for something. So that may add to that. Um, why do you think some people have a disposition for IBS or IBD? Is it genetic? Is it something we can change?
The etiology. So etiology is really just the cause or the origin. The etiology for IBS is really unknown. What they say is that it's multifactorial in origin. There's multiple different avenues that aid in the pathogenesis or the creation of the disease, and one of them would be genetics. So what they think is that there is some sort of genetic predisposition towards the condition. Whether you have a parent, a grandparent, whoever, that is going to play a role in the expression of the condition. Now, one of the biggest things that's coming out now about genes is that we're beginning to learn that diet and lifestyle play a big role in the expression of the gene. And there's a field called nutrigenomics. There's actually a really good practitioner. She's a biologist. Her name is Dr. Rhonda Patrick right now, and what she's doing is it's a new field called nutrigenomics. Really, what they're studying is the impact of diet and lifestyle on the expression of a gene. So most people, when they think of genes, they think, okay, I have this gene. Like, let's use the breast cancer gene. I have the breast cancer gene. That means that I just have it, right? There's a greater predisposition, and that's just something I have to deal with. But what we're learning is that your diet and your lifestyle actually play a major role in impacting that expression. So not only can we increase the expression, but we can also decrease the expression.
So you don't have to just feel like you're on a one-way path.
Mm-hmm.
You could actually escape from maybe some of this genetic predisposition.
So there's not a lot of hard research on what we can and can't do yet. So I can't really make a comment on that. But what I can say is that living a healthy lifestyle, making sure that you're eating the right foods, it will play an impact in decreasing your predisposition for these conditions, and it will play a big role in decreasing the expression of certain genes.
Um, can what can Crohn's be diagnosed? And this is an IBD.
Mm-hmm.
Do you know about if Crohn's could be diagnosed when it's inactive?
So typically the reason that it's difficult to diagnose an inactive condition is because there aren't symptoms present, right? You're going to be going to your physician when the symptoms are present, but they're only going to be present when it's active, right? So can it be diagnosed? Absolutely. Because what we're looking for in Crohn's, what we're looking for in these inflammatory bowel diseases is we're looking for inflammatory responses and changes in the tissue and the lining of the GI tract. So we can absolutely see them when it comes to colonoscopies. We can see them, on the scope. And if we do a biopsy, we can actually find damaged tissue.
Um, this environment. You say environment plays a big factor, and that obviously is what you eat, as we talk about. But what about smoking? Does smoking maybe increase your risk for these diseases?
I don't know the direct link between smoking and GI conditions,
And
but
we're talking about smoking tobacco,
yes,
right?
yes. But I do know that smoking tobacco pretty much plays a role in the pathogenesis of every condition. So, tobacco pretty much has a link with almost every single inflammatory condition. Tobacco smoke is a huge inflammatory factor, and smoking tobacco in general increases inflammation in your whole body. So I have no doubt that there is a role.
Is there a specific agent that causes most of the problems from smoking? I think benzene is one I've heard of. Is there any? Is it the smoke itself? Is it the tobacco? Is it the wrapper? Is it the filter?
I think it's a combination.
Okay.
Yeah, it's definitely a combination of the components of the cigarette.
Is that maybe why some people would go to vaping to avoid that? Have you heard about vaping maybe causing similar symptoms, or does vaping not have that?
I've not heard any correlation between
Okay.
vaping and GI.
It does where you live, is your region, your heritage. Does any of that play into maybe you might having one of these diseases or not? Maybe you're more predisposed.
I believe it can, and the reason I believe it can is because when it comes to heritage, really we're talking about just genetics. So if we come back to that genetic conversation, if you live in a location where a certain condition seems to be very prevalent, there is most likely some sort of genetic correlation to that disease.
So, if you have this disease and you have a limited diet, there may be some people that live in an area that they can't get certain foods, or then maybe they can't get to as good a medical care, or maybe they can't afford it. What would you say the best way to kind of help alleviate these symptoms, on a budget?
Mm-hmm.
What's the best food to get? How to help yourself the best way affordably?
Yeah, that's a great question. So the biggest thing is going to be doing the essentials. I always come back to the essentials. There's a lot of practitioners that are doing really good work with, helping to manage the symptoms of these gut conditions. But coming back to the essentials is really going to be huge, right? So if you don't have maybe the money to see a physician, or if you don't have one locally, what you can start doing is you can start just doing the essentials really well. So when I say the essentials, what I mean is decreasing stress, right? Stress has a huge correlation with gut conditions. So decreasing stress.
How would you do that?
How would I do that? So decreasing stress would be things like mindfulness, meditation, belly breathing. So diaphragmatic breathing plays a huge role in what it does is it actually activates your vagus nerve, and your vagus nerve is your center for parasympathetic nervous system. Your parasympathetic nervous system directly shuts off your stress response, and it turns on your body's natural ability to digest and rest.
So no stress eating.
So yeah, so getting away from stress eating, that's huge.
And you talked about it before, and I picked up on it because I've seen a few of your seminars, and I watch people that I care for, and I'm like, you really should settle down before you eat that, and they just look at me like I'm crazy,
Yeah.
and I'm like, no, if you really believe in what I'm telling you, settle down first, relax, because a lot of people, they come in, they're hungry. They sit down and they just want to eat something. They turn on the TV, the stress from that,
Yeah.
and you see it, and then all of a sudden there's a discomfort, like
Absolutely.
almost immediately.
Absolutely.
So that stress is actually a big deal. Is there any other things you could do to help that digestive process?
Yeah, absolutely. So stress is going to be huge, right? Breathing, mindfulness, meditation. Next level is going to be diet.
Okay.
Right. So lifestyle, diet. Back to lifestyle, just doing some moderate exercise.
Okay.
But when we talk about diet, it's making sure that we're having high levels of these prebiotic fibers, like we were talking about. So green leafy vegetables, they're going to be your most nutrient dense food that you can eat. Increasing spinach, kale, mustard greens, arugula, things like that in your diet, they're going to drastically increase your vitamin and nutrient density in your body. That's going to help a lot. and it's going to feed your natural gut flora. Coming into things like eating probiotic foods, supporting that gut health, and then eating things, like making sure that you're drinking enough water on a daily basis.
What is enough water?
So enough
For
water
an average person,
so
say 180 pounds.
180 pounds would actually be about 2.5 liters of water.
Okay,
I'm
that's
not sure.
not terrible.
I'm not sure the U.S. conversion, but it would be about 2.5 liters of water. So most people are really only drinking about, if you take one of those 16-ounce little bottled water, maybe 1 or 2 of those a day.
Right.
That is nowhere near enough.
And what is the main drawback of not drinking enough water?
I think that's complex, but I really do believe it comes to people have a sweet tooth. A lot of people like to drink their soda, right? A lot of people like to drink flavored. They think water's boring.
Right.
Right.
But that's true. Most people drink everything but water.
Mm-hmm.
Yeah.
Most people, when I start to talk to them about water, it's actually not that hard for them to change. I think it's just that people don't really think about it.
They need a reason.
And they need a reason to
start. So are there any people, let's say that someone is, and they, after they hear this or they read or they study, or maybe their doctor's given them a little bit of an indication they might have IBS concern, is there any person that might be someone that should pay more attention to this than others? Like, are there certain diseases that are added risk factors? Like let's say a person that's pregnant, or a person that has diabetes, or a person that smokes, or, out of things like that, what would be maybe those people that have those other conditions or those other environmental factors? Who should pay more attention to it? Who should be, hey, I need to really pay attention to this because I have this risk factor, or I have this condition, or I have this environment, that I'm constantly in.
Yeah, risk factors are really going to be, they're not as much conditions. They're going to be more specifically lifestyles. So anyone who has, a very stressed or overwhelming lifestyle typically are going to have a greater predisposition for a GI condition. And I would say 100% of patients that I work with who have GI conditions have some sort of stressor in their life. And that stressor plays a big role in the onset of their condition. And then, the other portion is going to be anyone who maybe doesn't have the best diet. So another part of that essential list is going to be avoiding things like refined grains and refined sugar. But the Western diet today, which, we all live in.
We all get a roll.
Is going to be, really high in refined grains, really high in refined carbs, really high in refined sugar. That all feeds unhealthy bacteria.
I had a friend of mine who was talking to me the other day. They're like, when I go out to eat, I try and get my money's worth. So I fill up on those rolls and those chips, trying to, and that makes sense. You spend a lot of money when you're trying to get a value out of it. Now, that would lead us into the kind of a gluten allergy like celiac, right? Do you have to have celiac to have a gluten allergy?
So you don't have to have celiac to have a gluten sensitivity.
Okay.
To have a gluten allergy, yes. So
Okay.
Celiac disease is defined as a gluten allergy. So what they're looking for, there are what are called immunoglobulins, which are essentially inflammatory molecules that are released in response to something the body tags as an antigen. One is called IgE. IgE is going to be for allergies. That is released in response to certain proteins that the body tags as an allergy, right? If you have bee pollen, you're going to have an IgE response. If you have gluten, you're going to have an IgE response. When they find that, that is the diagnosis of celiac disease.
Okay.
If they do not find that, you do not have celiac disease. But that does not mean that you're not having a response to gluten.
Okay.
But the difference is you're not going to have that IgE response. You're going to be having these IgA or IgG responses, which are actually more mild and delayed responses. So rather than having, there's anaphylactic shock. Someone who's really allergic to bees gets stung, they're going to go into shock. They're going to need epinephrine, right? They're going to have to go to the hospital. That's a very drastic, acute, immediate response. These responses are going to be more delayed and less drastic. So when you eat a food, these responses can last up to 21 days of these minor levels of inflammation, releasing these inflammatory molecules, causing you to have these symptoms of discomfort, of bloating. So you can have a gluten sensitivity but not actually have celiac disease.
So it'd be more of a smoldering, allergy than a acute, raging
Absolutely.
allergy. What's the percentage of people that have a sensitivity to gluten?
Hmm. So, that would be a hard question to answer. What I can say is that an inflammatory response towards gluten, there has been some good research done, and what they've found, in actually one of the studies, they found that every participant that ate gluten had some sort of inflammatory response.
Okay.
It didn't mean that everyone had a sensitivity, but every single patient actually had some sort of inflammatory response towards gluten.
Wow. Wow. So knowing that many people will be affected by it in some way, what are the common types of foods that have gluten?
Hmm.
Because I know there's a lot of people that talk about gluten, they talk about celiac disease, and many people I know they just sit there and they just nod their head, but they really don't know where is gluten? Where do you
Yeah.
find it in food?
So the main food is going to be wheat,
Okay.
right? So wheat is going to have very high levels of gluten, and gluten really is just a protein that's found in the grain. And one of the reasons it's so high in wheat is because over the last couple decades, we've modified the wheat in certain ways, and that's actually caused the gluten density to actually double in wheat.
Wow.
So we didn't have a lot of gluten issues in the past. The reason for that is because the food we're eating today just isn't the same food we used to eat.
Um, we thank you for joining us. Do you have anything else you want to add to this IBS IBD discussion before we get out of here?
I think no, I think that we
Okay.
said a good amount.
We want to thank Dr. Robert Corvino of Array Strength. Thank you for joining us at Wellness Way USA, and God bless.